quadriceps tendinitis. Hello, I'm Dr. Mohit Arora. I'm working as a consultant orthopedic surgeon in Gurgaon. So today in this video, I'll be talking about a condition called quadriceps tendinitis. Now, this is a condition wherein the patient complains of pain in the suprapatellar area where the quadriceps muscle is inserted in the form of quadriceps tendon over the superior pole of patella. Now, this is more of a degenerative condition specifically occurring in older adults. If you compare that with jumper's knee, which occurs in younger adults engaged in athletic activities. Now, if it's more of a degeneration of the quadriceps tendon, we call it quadriceps tendinosis. Now, the diagnosis is a clinical one, wherein the patient will specifically complain of pain in the upper pole of patella around that area, and the active knee extension against resistance would actually aggravate the pain. Now, as far as radiological examination is concerned, sometimes we see a tractional spur on the superior pole of patella, which we call anthesiophyte. Now, as far as the management is concerned, the management is simple: activity modification, then rest, ice compression, limb elevation, and taking a break from that particular activity which is actually causing this condition. Now, there is another option that I offer to my patient, who present to me with quadriceps tendinitis. If they are not responding to the usual conservative means, is the option of giving them PRP injection. So, PRP injection is a thing wherein we take the patient's own blood, we filter it, we separate the PRP, which is platelet-rich plasma, and we inject that around the site of involvement, which is the quadriceps tendon. So what happens is, it is full of platelets and growth factors, which accelerates the healing of quadriceps tendon, thereby relieving the patients of its symptoms. So this is another option for those patients who are not responding to usual conservative means. Thank you.